in your head, things that you didn't quite understand from the modules or you didn't understand on the presentation, please slow them down. And let's see, this training, you can have as much training as you want. You'll have the ability to phone Fred if you needed anything, you get caught in the middle of something and you don't understand it. So it's ongoing training. And he is going to start and walk you through an operational plan. So my 10,000 words have been expelled.
My turn already.
Yep,
Okay.
That was quick.
Thank you, Andrea. So what we're going to actually do is walk through those 3 steps that Andrea introduced you to, the operational planning piece, and then actually monitoring it through its life cycle, and then the PDCA cycle. So what we've done is created a little organization we call USA Public Health. I'm going to take you right over live into the system here. So when you log in, I think a lot of you have already logged into the system. When you log in, you're going to see a menu similar to this. This is the administrator menu. So the other types of users have less buttons over here is all, but pretty much the same menu here. Now, up at the top, you're typically going to start out at your Groups tab. And your Groups tab, as Andrea mentioned, is the organizational structure of your department, plus things like the high-level plans. So, FAB has what they call their 6-pack of plans that you see up here: strategic plan, CHIP, QI, emergency ops, and workforce development. So those are typically groups within themselves, and they're typically reporting up to the department. So you can see over here the levels. So level 1 is the top level, and they all go all the way down to level 10, but nobody's ever gone past 6 because it gets huge at the bottom of that pyramid if you do that. But you look at like admin and finance and HR. Now you notice when I came in here, I was immediately taken to community health division. So what that's indicating is my login is attached to community health. So everybody's going to be attached to their default group here. For today, we're going to actually go down to our tobacco program. So we're going to walk through this development of this quick little operational plan. And it's a pretty simple plan, so you can kind of see how each of the different levels looks in the plan. Then we're going to walk through the PDCA cycle with it here. So underneath the Groups tab, I've selected tobacco. So everything to the right up here, and by the way, these tabs represent the pyramid laid on its left side. So you see the organization, groups, service initiatives, goals, objectives, and activities. So it's just that pyramid. So we're going to walk down through the pyramid. So every time I click on a new tab, it's going to be the tab specifically for, in this case, tobacco. So these are the services initiatives specifically for the tobacco group. So, and the services are big buckets of things that you're doing. So for instance, tobacco cessation is a big bucket here. Secondhand smoke is a big bucket. And tobacco initiation prevention is a big bucket. So for today, we're actually going to go through tobacco cessation. We're going to walk down through the plan. So we're going to look at the goals for tobacco cessation. And the goals are typically very simple. They start out with kind of an action verb and then just a very brief description of what we're going to do. So for instance, you'll see up here, reduce smoking in high schools is one thing we want to do. Reduce smoking at colleges is another thing we want to do. Reduce smoking in public areas. So those are kind of 3 of the things that you might consider to be high-level goals in the plan. So now as we go down for reduce smoking in high schools, we're going to get more detailed yet. So we're going to look at objectives. Objectives are typically SMART. So they're specific, measurable, attainable, realistic, and time-based. So let's take a look at this first one. We're going to reduce smoking at Wayne High School, so we're very specific, by 25% by the end of the school year. So it's a very finite target that we've created here. Now the objectives are what I call the what and not the how. So this is what we're trying to accomplish here. When we get down to the activity level, it's going to be how are we going to get to that objective here? And that's a pretty critical area. A lot of strategic plans typically stop at the objective level. So we've got a great target, but the idea is, how do we know how exactly we're going to accomplish this? We'll get down to the objective level here in a second, or the activity level. The objective level, we assign a person we call an objective lead. The objective lead is anybody in the organization. You can pick from the whole organization, all of your users. But in this case, we picked Steve. Steve's job in here is to be able to get us to that target. Not necessarily do all the work to do it, but he's going to lead the team, if you will, who's going to get us there. So what we're going to do is now, first of all, I wanted to I apologize here, take a second. And as you noticed, as we've gone down through the goal screen and the objective screen and the activity screen, you'll see these traffic lights out here. Traffic lights are just merely a visual indication of the status. And it's very simple. It's kind of exactly what you'd expect. The green light is things are moving along as expected. The yellow light means something is potentially going wrong. Not necessarily has gone wrong yet, but something we're anticipating. So maybe a year and a half ago when this COVID thing came about, you didn't know what was going to happen to the department resources and such. You might mark it as yellow and say, hey, this thing called COVID has come along. We're not sure what it's going to do to our resources here, so I'm going to mark it as yellow. There's a red light in there. The red light would be, maybe 6 months ago after you've been fighting COVID for a year and now you're getting into vaccinations and you just don't have time to focus on this program. So I might put a red light in there and say, due to COVID, we're going to have to put this program on hold until further notice, something along that line. And then there's a gold bar, and the gold bar indicates successful completion. So what you're trying to do in most cases is get to the gold bar. You got a set of activities or objectives, and what you're trying to do is get to that gold bar in there. So now for reduce smoking at Wayne High School by 25%, we're going to look at the steps we're going to go through to get there. And this is what we call the operational portion of the plan. So these are just some things that we've kind of made up looking at different plans over the years here. So number one, complete or create training for students and faculty on the dangers of smoking. So we have what we call the activity statement down here. So that's what we're going to do is create training materials. The performance metric or target, the performance metric is how do we know when we've successfully completed the activity? So if we're trying to create training, once we've created the training content materials, we're done with the particular activity down here. We have a date range in here that we've set, a beginning date and ending date. So this is the time frame in which we're going to complete the activity. The project-based activity, you can see there's 3 types. We'll talk about all 3 here in a second. Project-based is the most common and the simplest activity. Project-based activity is measured by a % complete. Now, just as an FYI, there's some new features being added here. And one of those is going to be, we've seen a lot of times where this activity is merely a yes or a no. So instead of a % done, you're going to be able to just check a little box that says yes or no in there that you've completed that, and it'll mark it as 100% for you. It's just a kind of a simpler interface for the people who are working on it. But typically it's 0 to 100%. So for instance, down here you have these notes and comments. Typically every time you make a change in one of the planning elements, you're going to put a note in there as to what you did and why. So for instance, here we have completed chapter 1 and 2. So maybe when we got to that point, this would have been marked as 50% complete. And then, as we get to chapter 3, 75, and chapter 4, 100% complete. So that's the project-based activity. Every activity also has the ability to assign a team of people here. So I click on this little pencil icon and then open it up to the whole department. What I'm seeing is I have Steve Hansen here, and then I have Andrea shown. Over here we have 3 columns, team member. So you see we have 2 team members, Steve and Andrea are team members. We have a team lead. Who's going to guide this activity here? That's Steve. And then we have this email notification. The email notification is part of what we call the quick update system, real-time planning. The reason that's important is as you have gone through and created all your plans, so your CHIP and your strategic plan particularly are going to have hundreds and hundreds of activities out there. You probably don't want to be the person who has to update all those activities, meaning you got to contact the people who are actually doing it, text or email or phone, find out exactly how they're doing, go back into the system and create the updates to it. The system does that for you. It'll send the email out, in this case to Steve, on a regular basis that you decide. Steve will be asked to go in and update his particular activities or objectives that he's assigned to, and he's going to update that typically on a monthly cycle. So what you're going to be able to do is just go back in and look at the result. So that's what this email notification is about. We're going to talk a lot more about that as we go through here. Over on the right-hand side, we have this column called FTE, or full-time equivalent. This is an optional tool, but what it allows you to do is determine the human resource investment in this particular activity. So over here, you can see we have Steve at a 0.1 FTE and Andrea at a 0.3 FTE. And what we do with that very simply is just roll it up that pyramid. So down here, you see for all of the team members, it's a 0.4 FTE. And if I look at all of these activities and go back up to the objective, you're going to see down here, it's a 1.0 FTE. So all of those objectives roll up to a 1.0 FTE. So you're looking at the human investment, if you will, in completing reducing smoking at Wayne High School. And we'll see a little bit more about that in a minute here. The other thing you can do is assign external partners. So especially in your CHIP and your CHIP activities, you're probably gonna have a lot of external partners involved. So down here again, I can click on here. I'm saying that the VMSG dashboard is an external partner, and Fred Erickson is the contact name at the external partner. You guys build your partners into here. This is, you're gonna add the partner organization, and then you're gonna add as many partner contacts for each of the organizations as you choose to. So I can go select here, select Fred, and then save it in there. Now, the partners are a couple of things. Number one, they're tagged in here so that you know who you're working with on each particular activity. You can also, if you choose to, make the partner an external user in the system. And that external user then will have the ability to be assigned as the email notification and even the lead on that particular activity. So now the email can go directly to your partner to update the activity and come back in so that your person doesn't have to go to the partner and then bring the information back and put it in the system. It can go automatically. And by the way, we're happy to train your partners. It's a pretty short training, maybe a 20 to 30-minute training module that we can put together and train your partners on how to do this so they're not just seeing something new. And again, we can also train all of your folks who are going to be responding to these email notifications. So that's our first activity. The project-based activity is create training for students. Our second one here is what we call a QA activity, quality assurance. The QA activity is unique in a couple of factors. Number one, you notice it just has a beginning date. So the QA activity and QM activity are set up by this little wizard here. So I've got a frequency on a QA activity. How often does this repeat? And you can look at it, you go anywhere from weekly to every 5 years. What it's doing is it's actually, every time you input data, it's going to allow you to move the start date ahead. So in this case, we're creating training sessions every month. Our start date was 8/18/21. It also has the unique ability that based on the input that you provide, you can automatically set the traffic lights. Now, most traffic lights are manually set based on the information that you bring to bear on that particular activity. In this case, it's a very simple calculation in here. You're going to set a high value, in this case 9. Between 6 and 9 is yellow, and then below 6 is red. So you put in the 6 and the 9, obviously you can calculate the yellow for you. The other thing you can do with these is by clicking on this little guy right here, the greater than or equal, you can make it less than or equal. So thinking about a golf score, lower score is better. You can do the same thing there. So the green becomes the lower score. The metric type here is just a description of what you're doing. In this case, training sessions provided. So the wizard on the QA activity and the QM activity we'll talk about in a second automatically create the performance metric for you. So in this case, it says our metric is we're going to provide 9 training sessions each month on the dangers of smoking to students and faculty. So our performance metric is training sessions provided monthly. Green is greater than or equal 9, yellow 6 to 9, and red is less than or equal to 6. Down here, you're just going to be entering that number. So every month, for instance, you might go in and say, here's how many training sessions we did. It's going to sum them all up for you over time, how many you've done, that sort of thing. Every time you save this, every time you do an update, it's going to ask you, do you want to update that start date? And it's going to give you a couple choices. You just say, no, I'm going to leave it where it is. Maybe you're doing an interim update during the month. You can say, I can set it to today's date. So maybe the beginning of the month you did the update. So you're going to set it to today's date, or you can select the date to put in there. So you might update it and then put it on, maybe Monday is the first of the month, something along that line. So that's the QA activity. It's repetitive and it automatically sets the traffic lights for you. And again, you got the team and the external partners involved. And then our third activity here. So we've got, we're going to create training. We're going to use the training to train students and faculty. And the next one is we're going to contact all 20 tobacco vendors within 1 mile of Wayne High School to assure that they're not selling to minors. Okay, so that's probably a good thing to do. Just go out and make sure that nobody is selling to minors. We've got that under control. Now, again, our wizard here, in this case, a QM activity has a beginning date and an ending date. So this is the time frame we're going to do it. We have a target in here. The target allows us then to calculate our % complete. And then we have, again, the metric type. Down here at the bottom, we have this unique input here, data entry type. If you're adding to a QM activity over a period of time, like you're trying to contact all 20 vendors, you may be doing that over the course of 6 months and just want to do, once a month, you're going to go in and add to this number in here. So in this case, you put in a target of 20, I enter the value to add to the total. So every time I do an input, it's going to add this to my total number down. We're already at 20 at this point in time, but I could put in another 5 and say, this month we contacted 5 of them and it takes me up to 25 and that sort of thing. Or I can say enter a new total value. So if you're planning on doing this, let's say in a 1-month cycle, and you're just going to put in one number at the end of how many you've done, you might want to select add a new number to, or enter a new number to add to the total value here. So that's the QM activity. Now there is one other option on a QM activity, and that is what we call a zero target. The target is obviously the denominator. If you have a zero target, it can't divide by zero. So what you're looking at here is, I just want to count how many we've done. In this case, we have a target. We got 20 tobacco vendors, we know it. In some cases, you might have, we had a health department in Ohio who did plumbing inspections. And they didn't have any idea of how many they would be doing because it was at request. So as the customer requested a plumbing inspection, they would do it. They just want to count how many they did. So we made this zero target, and then all it does over here is just count up the number that you've done in there. It doesn't try to calculate the total, obviously, because there's no target to calculate against. So it's just accounting, if you will. So those are the three types of activities that we have in here. Now, looking at this plan, so we're going to create training, we're going to train the students, and then we're going to contact tobacco vendors. So that's kind of three of the things we might do to get to that 25% reduction in smoking. Now, if we go back to our pyramid here, let's just walk through that. So if you recall, the group was called Tobacco 2021. The service is tobacco cessation versus the other two that we had in there. The particular goal within tobacco cessation is to reduce smoking in high schools. That SMART objective was to reduce smoking at Wayne High School by 25% by the end of the school year. So that's SMART objective. And then the steps we're going to go through. We're going to create a training curriculum. We're going to provide training, and then we're actually going to contact local tobacco vendors. So that's what the operational plans look like. Every plan is formatted exactly the same. So it allows you then to be very familiar with the format and the structure of the plans as you're going through and updating your plans. Now, through the PDCA cycle. So what we just did is the planning part. We've got this nice plan in place. Obviously, we've been executing the plan in the do phase here. And what we're going to do in the do phase is set up this thing we called the real-time planning, and that's that email notification. Now, most often, our health departments, there's about 240, I think, health departments using the system across the nation right now. And on the average, they do it about once a month. You can do it anywhere between daily and monthly. But what's happening at this point in time, as the month cycle comes around, it's going to send out an email notification to those people who are responsible for the activities and the objectives. They're going to go in and update the information, so we have a continuous update going on. Then we're going to go into the check phase. So at some point in time, let's say monthly, we're going to actually go in and check and see how we're doing in here. And to do that, most often your check phase is going to be at the objective level. The objective is, again, in the target, and how are we doing against our target? So typically, you're just going to go down and use this little chart guy here. So this is our percent reduction here. You notice we started out at 0 before we, as we kicked off the program. We got to 10%, 15, 20, and capped off at about 25%. So kind of exactly what we thought would happen is happening in here. So we go back to our PDCA cycle. We're going to go into the adjust phase. In the adjust phase, we're going to make any corrections necessary. Well, the good news is everything's working beautifully. We don't need to make any adjustments. So we're not going to change the plan. We're going to continue on with the execution. Come back, let's say on a monthly basis, and check it. You determine what this is. The cycle can be. It can be monthly, quarterly, whatever you determine. So in this case, we're going to check it again. If it's still on track, we're just going to go through the cycle, keeping an eye on it here. Now let's go back and look at a slightly different example here. So we've got a second objective of reduce smoking at Desert Vista High School by 25% by the end of the school year. And you'll notice it's yellow here. Now, anytime you make a change to a traffic light or anything in the objective, you're probably going to want to put a note in here. So anybody else looking at it will be able to go in and say, oh, I understand why Fred made that change in there. It says not quite the 25% target, COVID restrictions on training and vendor visits. Okay, that kind of makes sense in there why we wouldn't get there. Again, we can look at the chart here and we had the same increase basically, but we capped off at about 21%. So we didn't quite make it to our 25% target here. And we now know that, but what we don't know is why. So this is where you're going to dig down to the activity level here and see what's going on. So the first thing we have is create the training. That gold bar indicates that we've got the training successfully completed, as you can see down here. The next one, we have a red light. It says provide 9 training sessions each month on the danger of smoking to students and faculty. Okay, apparently we're not getting there. So let's go look at the chart for that one. Okay, we started out with 0, obviously. We got up to 9 for a couple of weeks. And maybe this is where the schools started keeping students at home and going virtual on the schools. So we couldn't go into the schools and do the training anymore. So we're kind of kicking down here between 5 and 7 training sessions. So this, in this case, indicates that we're not going to be able to do the training, and apparently it's having an effect on our result there. And we go back here, and the third one is contact all 20 tobacco vendors. Again, we have a yellow light here. The yellow light is telling us difficulty contacting vendors due to COVID restrictions. Okay, some of these people may have gone out of business. Some of them are just maybe closed the stores temporarily, something like that. So you can't get hold of the people. Again, you can look at the chart in here and see we've gone up. This is that QM activity. So we added to it each time. We contacted 3 and then 7 and 11 and 12, 14, 15. And we're up here at 15 and didn't get to that 20 number up here. So that's probably why we're in the yellow. So now back to our PDCA cycle. So at this point in time, the adjustments. The adjustments come in 4 different types. The first one you saw is no adjustment necessary because everything's working to plan here. The second one would be, does it make sense to adjust the plan? So that's kind of a decision process that you'll make based on the surrounding, if you will. So in this case, maybe we have COVID that got in the way. We don't necessarily know when COVID is going to go away, when you guys are going to get your resources back. So maybe we want to be a little loose on the plan. So maybe we want to take that plan from 25 down to 21 so that we can be successful in doing that plan. And then the next one is adjusting the resources to get to the plan. So you saw we had an issue with being able to get to students to do training, and we had an issue with getting to all of the tobacco vendors in here. So what are the resource adjustments that we can make? For the training, it may be because the students are actually at home and we're not, we can't go to the schools and do the training. So maybe what we do is create a virtual tobacco training program. So that might be an adjustment that we make to the resource. The other side where we're trying to contact tobacco vendors may be the same issue. It may just be that maybe we've lost resources, don't have the people to go out and contact them. So maybe we get more resources to do that, or maybe even outsource that to somebody. So that's the adjustment to the resources to get to the plan. And then the fourth scenario is kind of a combination of both. You got the ability to adjust the plan and the resources. So maybe instead of 25, we take it down to 23, 22 for the plan. And then we go ahead and get the resources adjusted, maybe just doing a virtual training for the students and faculty on the dangers of smoking. So what we're trying to do is get ourselves to a point where we're still going to go up in the plan a little bit here as we go through the cycle. So that's the PDCA cycle. Every plan is going through that. You determine what the cycle is. And what you're doing is using this real-time planning to collect the information. I call it from the horse's mouth. From the people who are actually doing the activities, they're going to put the information in there so you can use the check phase to go in and make the adjustments where necessary to keep these plans alive. So this is one of those slides that Andrea made me put in, so I take a breath. Any questions at this point? She's mean to me. Nope. Okay, let's go on through them. We talked about performance monitoring at multiple levels. The micro level is what you saw before, those individual charts at the activity and the objective level. How are we performing there? I want to look at the macro level. I want to look at the entire department or my entire area of responsibility. I can go to the actual dashboard itself. So I'm going to go back to my group screen. Let's go ahead and look at, so community health division, let's say I'm the community health division director, and I want to say, how is my portion of the business running today? I just go up to the dashboard screen up here. It takes about 10 seconds to calculate all the values on the screen here. And I said, and there we go. Okay, so this is the dashboard screen. There's a lot of data on here. Let me show you what you're looking at. So number one, up in the top left corner, I call this the big picture. You can look at the number of activities or objectives or goals in each status. So you've got the red, the yellow, the green, and the gold here. You'll notice when I roll my mouse over, it's clickable, meaning that I can drill down. So if I want to see what that red activity is, I can drill right down to it, make the corrections, maybe assign it to somebody, whatever I need to do. And then this schedule gauge up here is the calculation for all of the activities included in here based against beginning date, ending date, and percent complete. So it's calculating how far are we ahead of or behind schedule. It's red on here because it's greater than 60 days behind schedule. As we get down from 0 to 30 days behind schedule, it's yellow, and we get on or ahead of schedule, it turns green. So just by looking at the color of the lights and these numbers, you can get a good idea of, in this case, how community health is performing here. Down at the bottom, we have a lot more to drill down to. So number one, those activity leads, those folks that we assigned as activity leads and email notification in the activity screen itself show up down here. So you can see we have Diane Cox. It's red because Diane hasn't been in 60 days and updated her information. Now with COVID, out there, it's pretty typical. A lot of these screens are red. If it was yellow, it means she'd been in within 30 to 60 days. And if it's green, it means I've been in within the last 30 days. So you can tell just by looking at here, our data is kind of dated on here. Where it's appropriate, you might want to go out to these folks and see if you can get them to go in and update their information. Here's that FTE number again. It showed up at the activity level. So what you're doing here is summing up the total FTE utilization for each person. So you see Diane has a 1.25 FTE, meaning she's doing the job of 1.25 people. You might want to go in there and tweak that. You can drill down on all of her activities, look at some of them, say, hey, I can reassign some of these to maybe William down here is a 0.3. So maybe I can assign some of them to him and get her down to that magical 1.0 level. Lagging is calculated just to be behind schedule. How many activities are behind schedule? Again, beginning date, ending date, % complete is pretty easy to calculate that. It is color coded as to how far. So red is 60 days, yellow would be 30 days, and less than 30 days would be green. Days is the same as the schedule gauge up here. So it's saying that for Diane, she's 184 days total behind schedule. Again, with COVID or something like that, it's potential that they're going to be way behind schedule. Overdue. This says we have 19 overdue activities, just meaning that the ending date on the activity is come and gone, not yet 100% complete. And then you can look at the number of red, yellow, green, and gold activities for each person. So if you think about it, looking right across one row, you get a great snapshot of how this person is performing against their assigned activities. Now I have two other views here. One is groups. So remember the group screen that we saw that has all your plans and your divisions, offices, and programs. I can show those down this column here, and I can see the same exact information for the group or the strategic priorities. So at the very top of your strategic plan are typically at the service initiatives are your strategic priorities. What you typically want to be able to do is map everything else you're doing in the department against your strategic priorities, because your strategic plan is the overall plan for the entire department. Everything else should fall underneath that. So what it allows you to do is compare all your other plans, your workforce development, your QI, everything in the divisions that you're doing against those priorities. So you just make sure that you've got a good, even response based on your strategic plan. So you can look at those down here. Top right corner says My Priorities. And what that is the ability to select specific objectives and just keep your eye on it. Most often they're going to be yellows and reds because the greens are on track and the golds are already done. So these are just things that you want to keep your eye on. So I can roll over and get more information on here. But these are unique to your login. So you pick the ones that you want to watch. You can drill down on them. You can go in and contact Steve, say, hey, Steve, why is this a yellow? What are we doing to get it back to green? Something like that. So it's just individual items that you want to keep your eye on. So that's the dashboard screen.
I have a question.
Yes.
When a project gets the gold bar status, do the FTEs fall off the total FTE?
Yes, it does.
Thank you.
Once the activity is complete, then it doesn't calculate that FTE in there anymore. Good question. Oops. Okay. Now, while COVID was happening, we had a lot of dust bunnies in our email, as Andrea likes to say. So we decided to make some updates to the dashboard, and this is one of them, VMSG Mobile. VMSG Mobile is unique in that it's a phone app, but it's a dynamic phone app. It doesn't require you to download an app from the App Store or Google or whatever it is. It builds the app on the fly in your browser on your phone. So now this is the same dashboard you just saw broken down into 3 phone screens, if you will. These arrows take you back and forth. So this is the top left corner, what I call the big picture. This is that detail down at the bottom. And then over here is the My Priorities, the top right corner. So you can go back and forth. You got exactly the same information down here. You can drill down on anything and get down to the specific details. But if you're just driving into the office or sitting having coffee in the morning and say, hey, how's community health doing? I can go right on my phone and take a look at it here. You can look at your strategic plan. You can look at your CHIP. You can look at your CHA, everything you want to do on the mobile dashboard in here. And again, you don't have to worry about updating this. It gets all updated automatically. So it's available to you. If you go to login.vmsgdashboard.com, the same place you do to log in on your desktop, it'll sense that it's a phone and it'll bring up this particular application for you. Document management. Do you guys know how many documents you submitted for reaccreditation?
A lot.
I hear that answer a lot. Well, here's the real numbers that we've counted over all these departments, somewhere between 300 and 1,000 documents. So, that's a lot of documents to keep track of. And if you're going through, these folks are going through the initial accreditation process, you're building up all these documents over years, and you're trying to figure out where they are at the end when you put them into eFab. What we did is build document management right into the system. So if you're using the system from the beginning, you can attach all the documents right into where they belong, into the activities that they belong to. And I'll show you the accreditation and reaccreditation plan here in a minute. So you can attach the documents there. So when it's time to go back, you can just go back and say, here's the 5 documents we're going to submit for, measure 9.1.1a or something along that line. Document management, all the documents are stored up on our servers. They're all, as you enter the document in here, you're going to have the ability to put in not only the document file name, but a lot more data. So you can put in an unlimited description. You can put any notes about the document. You can assign traffic signals. So maybe you've got a first version of the document and you sign it as yellow saying it's a first version. It does automatic version control for you. So if you put this same document in 5 times, you'll have 5 versions up here. Shows up in the version number column, just displaying the latest version all the time, unless you decide to show all versions. But it's just a nice place to keep documents. We decided we would not have any limitations on the number of documents or the size of the documents. So you can put anything you want up there anytime. Very easy to get to because they're attached right where they belong in the plans. Reporting, there's a boatload of reports in the system. The most common report that you use is one we call an operational plan report at the top, probably 95% of the time. There's a bunch of other reports to drill down to more data in the system, but the operational plan report is key. Oops, right. My finger's going too fast here. Operational plan this is the tobacco program. So remember, it was under the group Tobacco 2021. The initiative or service, in this case, was tobacco cessation. The goal was to reduce smoking in high schools. Our first objective is reduce smoking at Wayne High School by 25% by the end of the school year. Here's our reduction, some activities if you had that activated, and then the team lead is Steve. Down here at the activity level, you have all the detail that you saw on the activity screen, the number, the status, the notes in there. You can turn the notes on and off. You can actually show any documents that are attached on here, lots and lots of different things. But this is the most detailed performance monitoring tool is the operational plan report. It'll give you the detail all the way down to anything you want. Now, the operational plan report can be run at any level. It can be at the department level. So if you want to see, I recommend you don't do this, but you can see every plan, every report in the entire department in one document. We did this for Maricopa County one time just for fun, and I think we had 16,000 pages of document or something like that. So, and it took a while to run, I can tell you that. But operational plan report has all the detail you need in it. The next tool, which is really nice for sharing information, is we call VMSG Public. Let me show you a real screen here. Again, this is the example of what the tobacco program might look like. It's it's a point and click to take any of the data in the system and create these performance indicator rows you see. So there's 3 indicator rows on here. You can create them at any level you want. In this case, we have the goal of reduce smoking in high schools. Over here, you can see I can roll over and see the number of gold and green and yellow and red and the timeline. So these 2 kind of represent the same thing as the top left corner of the dashboard. Instead of a traffic light, obviously it's a pie chart in here. But looks like 11 days behind schedule. And we have, mostly complete green, yellow, one red. Again, I can do it at the objective level here. So I can look at the summary, again, same thing, status gauge. And then I can create a more detailed chart based on what we're talking about, create the training. So we had, quarter of the way done, half the way done, 3/4 of the way done, and all the way done down here. Once you do this one time, it takes you maybe 5 minutes to create this. You can have as many many indicator rows on a page as you want and as many pages as you want. These pages are created and stored on our server. So you just get this link that you grab and you can put it into an email, put it up on your web page, put it on social media, whatever you want to do with it. But it's just a very simple graphical view of status. A lot of times when you're talking to partners, talking to the public, talking to senior management, they don't want something like the operational plan report. It just would be too much data for them. So you might want to create something like this that just gives them the ability to look at it kind of in a summary view up here. So that's VMSG Public. Questions at this point?
Can I
Yes.
make a request?
Yes, ma'am.
This is not really a question, but a request. So as I've been in our dashboard and in our, I'm not sure what to call it, but within the Taney County Health Department site, can we change the name to say TCHD instead of, I think you've got it listed as Taney, oh, I should have had the Taney CHD department. Can we just say TCHD?
Hang on one second, let's go look.
I know that's really picky.
Well, I'll tell you, let me look at that because there are so many of these organizations in the system that they have to be, that has to be a unique abbreviation. Let me look at that and I'll let you know. If so, I'll
But
check.
like I said,
TCHD.
just a picky.
Yeah. The only reason it would have been that way is because there was another one, TCHD, you know, Tarrant County or somebody like that. So, but I will let you. The organization descriptions and such are all done by us, but at the group level, any of these things you can change, any of the abbreviations or any of this information down here, whoever's your administrators. So you guys have access to all that. Okay, and I'll look at that for you. Okay, three-dimensional planning. This is really kind of unique. It's not used a lot because I think maybe it's not understood a lot. But if you think about your plans as being two-dimensional, so you've got all your plans laid out on paper on your desk here, sometimes you might want to look across all those plans for commonalities, gaps, overlaps, that sort of thing. So we created this thing called three-dimensional planning, and it's the ability to categorize and subcategorize plans. So let me show you how it actually works in the system here. Let me go down to where we were in tobacco, service. So down here, this button is my categorization button, my three-dimensional planning. You notice the little blue eye on there, that indicates that it's been categorized. So if I look at it, it says, okay, it's categorized under our strategic priorities of enhancing stakeholder engagement, reducing health disparities, and broadening agency marketing communications, and also essentials 2 and 3 of the 12 essentials of public health and accreditation. These are kind of public health standards in here, but they're completely editable by you. You guys can create your own. You can throw them out of there. You can delete them, whatever you want to do. Very simple, and they're very easy to work with. So down here, you have all of the FAB domains. You got the standards plus the reaccreditation measures down here. So what you can do is go in and assign the three-dimensional planning attributes to anything in the system that is, for instance, related to reaccreditation measure number 1, for instance, if you want to say, okay, these are all the things we're doing for community health assessment, et cetera. So this is what it looks like. It's very simple. You'll select this, you'll pick that, and you'll click on it. When you do that, if I go ahead and do that, now it's going to ask me, because remember, we're up at the service level, and I've got goals, objectives, and activities under that. I can either categorize just the service, or I can say, yes, I want to categorize all the goals, objectives, and activities. I'll say yes, and it's going to do that for me. So now I go back and look at it. It's got FAB domain 1, reaccreditation measure 1 attached to it in there. So that's how it works functionally in the system. It's very simple. Every one of the service goal objective screens has this categorization in there, and you can go ahead and do it any way you want. So here's some examples. We already saw that the public health essentials in there. You might want to look across all the different plans and say, these are all related to essential number 1. The FAB standards in there. I can go in there and say, these are all the things that we're doing related to FAB standard 6.1. Remember, we talked about the strategic priorities on the bottom of the dashboard screen. Well, this is how that's done. You're going to categorize everything in your plans against the strategic priorities, in this case, partnering. So what I'm saying is, what are we doing to support partnering across the whole department? These are all the things that we're doing down there. And then you can do the same thing with documents. So once you get all those documents out there and attached, you might want to be able to go in and say, you know, FAB standard 4.2 or reaccreditation measure 4.2 or whatever it happens to be in there. So you can tag those documents. That way you can go back and extract the documents when you're ready to shove them up into EFAB, which you guys have probably already done now for reaccreditation, but that's what it's in there for. So that's three-dimensional planning. It's just a nice overlay to allow you to look at other things related to your plans, how they relate together. So we do have a accreditation, reaccreditation plan built in there. I'll walk you through the reaccreditation plan since that's where you guys are. So down here we have FAB reaccreditation. Now the accreditation plan, there's the state, local, and tribal version, and reaccreditation is all the same across all the different versions there. So down here, first of all, you have the 7 steps of accreditation, and you guys are obviously down at this last step in reaccreditation here. Services. You also then have each domain. So in the reaccreditation plan, there's no services under there. There's just a link to the reaccreditation measures. So then I go down to the 3 reaccreditation measures under domain 1. And remember, these are objectives. So this is, what am I trying to accomplish here? You're going to assign an objective lead, which is typically your domain leads at this level. You assign them because they're responsible for this. And then they can, or you can, assign those specific activities. Now, you'll recognize all of this text. It's nothing to do with anything we've made. This text is FAB information here. So what we did is took all of their information, condensed it down into an operational plan. So if you were to use this, maybe next time you go into reaccreditation, you might want to think about using this, because you can start at any point in time getting the stuff together for reaccreditation, the next go around in here. The activities, once all completed, and here's your document management. So in this case, I have a single document attached to that in there. You can attach as many documents, like I said, as you want in there. All these documents will roll up to that measure. You can go up to the measure and say, okay, these are the documents we're going to need to upload into there. So it's just a nice, safe place to keep all your documents in there. So this is the plan. We can help you if you decide to, again, when you get to the point where you're going to, get through this accreditation cycle or reaccreditation cycle, go to the next one. We can set all these dates for you. So let's say we're going to set the dates for 5 years out. We'll put those end dates in there. Put a beginning date as when you're going to start this particular piece of the cycle, which may be, the day after this reaccreditation. And that way you can take all the time in the world to get things moving forward. The people who you assign down here as the team leads on the activities, the objectives, will get those email notifications on a monthly basis where if they choose to, they can do the updates as we're going forward here. So that's the reaccreditation plan. It's built in. It's all set to go in your system. This is another kind of a nice tool. Did you guys do a mock site visit?
We have not.
Oh, okay. A lot of departments, before they do a final site visit, will do a mock site visit. Somebody comes in and looks at your documents, who's been through the process, and says, here's the kind of changes I would suggest you make, that sort of thing. What we did is we kind of took the COVID version, if you will, and made it virtual. So if you're using the reaccreditation plan, you've got all that plan information in here. Somebody can go in and we will train these people to, at no cost to you, on how to use this. It's a very short training. They go in and click on this review button. They put in the information, several different categories in here that they're actually going to put in. They can grade it with the traffic light. When they're all done, you can go in and generate a report that says, here's what we recommend that you do before your final accreditation site visit in here. So it's just it's a virtual mock site visit built in there. Help information and training. Lots of help in the system. And some of you have probably already been through some of the training modules, but let's say I'm at the service level right here and I don't understand what these icons are or what I'm supposed to put in these fields. First thing to do is always go to the little blue eye. It takes me right down to adding and managing services initiatives, where I came from. It gives me what I call kind of the left brain version over here, which is a definition of every field and everything on the screen. Down here at the bottom, if I click on this, it's going to take me to the portion of the training module. It's going to fast forward to the portion of the training module specifically for services initiatives. Down here is the full user guide. So it's a hyperlinked PDF file. We keep it up to date every time we make these changes and things in there. So if I click on that, I'll have a hyperlinked PDF file. I can click on a table of contents and go to any section I want in there. This is a kind of a unique document down here. It's called implementation guidelines. And what it is over the about 10 years that we've had this system out there with health departments, we collect a lot of great ideas from health departments on how to make things better, how to use it, and they're all in there. There's some forms in there that people have created to help you to visualize and create an operational plan before you put it in the system. There's some IT related issues around permissions that you need to have, browsers that you use, different things along that line, but just a lot of good information in there. So it's available to you anytime you want it under the little I button up here. The other thing is on this top left corner, you saw on this screen, are the training modules. So the introduction to VMSG dashboard is pretty much what we're going through today. There's a little bit more information in here, but I don't think I would go through it if I were you, if you've gone through today's training. I would go through the VMSG basics because that talks about on every screen, if I click the plus button, what's going to happen? If I click the red X, what's going to happen? And it's going to walk you through how to actually do everything on that screen. Operational plan development is kind of unique. If you're building, let's say you're going to build a plan for community health, it's kind of outside accreditation or whatever, and just what does community health do? It's got a lot of great examples of what's a service, what's a goal, what's an objective, what's an activity, and it's got screens full of examples of what they look like. What's the nomenclature on there? What do they actually look like? It gives you some information on that. Performance monitoring is reporting, gives you all of that, gives you all of the micro and macro level tools in there, so you can go in. And then administrator level training is for those of you who've been assigned as org admins. It's about managing users, managing the partner database, managing the categories and subcategories, all that kind of stuff. It's the shortest one. It's about a 20-minute module, I think. If you go through all of these top 4 modules, well, you guys, let's say these 3, I think it'd only be about 2 hours of online training, and I wouldn't do it all at one time. I would take, a lunch hour or something and go through those modules, but it's very, very detailed into what you're doing. Now, the other offer we'll make for you is if you don't really like doing, and a lot of people don't like doing online training, feel free to come to us and we'll do any of these training modules or any training on anything you want at any point in time. We want to have everybody know that we do all the training that you want. There's no additional cost for doing the training. We want you to be very functional with the system and very happy with the way it works. So just let us know when you get down, you have a bunch of questions, we can pop up another GoToMeeting session and walk through all that for you. We have one more section to go through and then we're done, but any questions at this point? Okay, let's finish it up then. Okay, real-time planning. This is what we've been talking about. Now, again, the reason that this is important is because you've got to be able to collect the information in somewhat real time to be able to manage your plans. It really isn't physically possible for a person to collect all the information, let's say just out of the Fab 6-pack of plans. You're probably going to end up having hundreds of activities down there. Those activities are being performed by individual people in the department out there. If you're the person collecting information manually, you got to call that person, email, text, you're going to have vacations, you're going to have voicemail tag, you're going to have all that kind of stuff. You got to explain what you're looking for. They're going to give you the information. You're going to go back and put it in the plan in the right place. It's going to take hours and hours and hours. So that's why we built this. Now here's how it works. There's a place in the settings that the administrator will set up. Most often, again, I said it's a monthly cycle. So let's say it's the first Monday of every month. On the first Monday of the month, the system's going to go in at 1 o'clock in the morning, and it's going to look at every user in the system, and it's going to ask 3 questions. Have you been in the last 30 days and updated your stuff? Do you have anything that's behind schedule? Do you have anything that's overdue? If any of those is true, out go the emails. And as I mentioned earlier, you can set up external partners to get those emails as well, so they can do the input versus having an internal person having to be the go-between. In that email is a link, and that link will take you back into what we call the quick update system. I'll show you that live here in a second. Quick update system is just a very simple way to update your activities and objectives. Now, just to give you an idea of all the health departments using this, this takes on average about 3 to 5 minutes per person per month to do the updates. So now think about that. One person doing hundreds of activity updates by phone and email and text, or each person giving you 3 to 5 minutes a month to keep everything up to date. It's a pretty effective system to do that. This is what the email kind of looks like. It's going to say, here's those 3 questions. Again, 30 days, behind schedule or overdue. Just a little kind of, for all the activities you've been assigned, here's the traffic light status. If you have any questions, and we haven't set this up on yours yet, but it's just a real simple process to set up for the people who are org admins, you can just assign which groups they're responsible for, and then they're going to be responsible. So they'll get tagged on here as their name, email address, and phone number on here. So you can call them, with any questions. And then I mentioned there's a link in that email, and here it is. You go to this on your desktop computer, you're going to get the full version. If you go to this on your phone, you're going to get the phone version of this. And there is a phone version of the quick update screens here. So when I go to here, let me take you in. I'm going to go ahead and log out. Just walk you through the process of what will happen here. So you're going to end up back at the VMSG dashboard screen. You can click this little link up here in the top right, log in, or just type in login.vmsgdashboard.com. I'm going to go ahead and log in. Now you're going to have your user ID and password. If you don't have your user ID yet, hit this button, put in your email address, and hit send. It's going to do is said, okay, success. What it means is I found your user ID and password. I sent them to you. It's going to show up in your email. Hit okay. I'm going to go back and show you what that email looks like. Some of you have already seen this. I know that some of you already logged in, but if you haven't, it's just very simple. Here's your user ID. Here's your password. The password is going to be a crazy cryptic string of characters that you don't want to try to remember. So when you log in, the first thing to do basically is to change that. On the login screen, you can either, notice up here, you can use that username, so in this case, F. Erickson, or your email address. So I could put in my email in here instead of my username. So if you don't want to remember another username, feel free to use your email address. You're going to put the password in. Now, here's where some people get a little confused. They'll go back and they'll hit send again, they'll put in their email again, and they'll go through the cycle and can't figure out why they don't log in. The next button to push is login at this point in time. We've had people who've done that, and they call me and email me and say, I can't get in. It keeps going through the cycle. That's what's happening here. So log in. So now, if you've been assigned as an activity or an objective lead, you're going to get this dialog. You can either go to the main menu where we've been all day here, or just go to the quick update screens. So let's go to quick update. Once you're at the quick update screen, it's going to go and look at every activity and every objective you've been assigned personally. It's going to give you the screen. Now the screen looks a little complex, but let me break it down for you a little bit. First thing I want to say is change your password. These buttons up, this button, the keys up here, click on that. Current password, new password, verify password, like every other website in the world. Very simple. You put that in there and it'll, verify that you got the right password twice and everything else. Hit the update and you got a new password in there. But I would change that because it's going to be a crazy cryptic string. Now the top half of this screen is merely context. So it's the pyramid: group, service, goal, objective, activity. It says I've got 6 activities I'm responsible for here. I'm on number 1 of 6. Got the activity, the performance metric or target. There's only 3 fields to update. That value, whatever that happens to be, it might be a percent field, it might be a numeric field. The traffic light, you just click through them, it'll cycle through the lights, and the notes field. Anytime you make a change, you might want to just put a note in there. Or anytime you do an update, you just might want to put, hey, I updated this on such and such a date or something like that. Something else we added over the COVID time was something that was requested by folks, and that is data source. So down here, if I want to just designate a data source, so let's say you're looking for the number of COVID vaccinations done in Taney County over the last month, or something like that. Maybe there's a link, let's say, to a CDC website or something that has that information. You can go in here and say the CDC COVID vaccination website up here, down here, put in the actual link. It can be as long as you want it to be, the link to that web page, and hit OK. So now what happens is you're going to have the text in here. This little link will take you to that web page. So and you don't have to have a web page, but if you do, you'll have a link in here that says, here's your web page. It'll pop open a new browser window for you with that particular web page. You can grab that information and copy and paste it into here, whatever you want to do. But it's just a nice little feature to know where am I getting the information, because a lot of times if you're doing this once a month and you've got a bunch of other things going on, you may not remember exactly where that information came from. So just the ability to do that. So down here, I can just go and cycle through the activities either with this arrow at the top or down here with the save and go to the next one. And if I cycle
Can
through
we put more than one source? Sorry, can we put more than one source on this?
In the text, you could. There's only allows for one link in there, though. Never been asked that before. Thank you. Activity 5 of 6. So I'm up here at activity 6 of 6. Once I complete that, I hit this button. I'm going to get a little dialogue that says you've also been assigned as an objective lead. So let's go to objectives. We'll look at that. Now the objective, again, is right here. It's in the middle, just where it is in the pyramid, right? So you got the group, service, goal. The objective, again, 3 fields to input. Your data value in here, which should be percent complete or whatever it happens to be. Traffic lights, you cycle through those, and your notes field. Now, if you want to go and update the activities related to your objective, they're down here. So you can click on those, go to that, go back to the objective. So it's easy to go back and forth in there. but you're typically going to update these 3 fields, hit the next button, and up here you said I have number 2 of 11 of the activities I'm updating here. Cycle through those. You have the document management up here as well. So those are the 3 documents attached in here. A little back arrow takes me right back to where I was. So this is the quick update. Now, quick update on your desktop and quick update on your phone. So if you log in on your phone to login.vmsgdashboard.com, first thing you'll do is go to Activity Quick Update. You'll notice it doesn't have as much context just due to screen real estate, but it's got the activity, the performance metric, your notes you can type in here, change the traffic light just by with your finger cycling through it, put the data value in here, and then save it. It'll again take you through all those activities, give you the same dialogue saying you've got objectives as well. Go in and do the objective, notes, traffic light, data value, next in here. So again, you can do those. So this was really kind of handy if you're out of the office doing something, you get the email on that first Monday of the month, and you just want to do the quick update. Maybe you're doing vaccinations and you got a break or something along that line. Just go into your phone, update the information, and then whoever is monitoring that information has got the latest information. You will show up on the dashboard screen as green with the latest date on there and everything. That was the drink out of a fire hose for the day. Questions, please. Yes, ma'am.
Could you show me how to change the password?
Yeah, very simple.
I know we need to change it, but I don't know where.
Okay. On the quick update screen, it's this key up here.
Which key?
On the top, the key at the very top.
On the quick update screen.
That's on quick update. Let me take you to the main menu screen. The main menu screen, it's right here.
Thank you.
The key's on that one. Okay, yeah, click on that. I would copy and paste the password out of the email that you get just because sometimes characters look like different things, you know. Just copy and paste and then put in your new password in there.
Thank you very much.
You're welcome. What else? Okay, so this is just, again, it was a drink from my fire hose. We talked about all the basic functionality. Couple things you can do from here. If you want to go through the video training modules, please feel free to. Like Andrea says, have a cup of coffee or 5-hour energy or something because they're pretty dry. There's a lot of information in there. However, if you want to go in and play around with what we've got here so far and make yourself a list of questions, things that you may be not understanding quite, whatever, then come back and let's schedule some ongoing training. We can get into any detail.
Fred?
Yes.
I'm sorry. Refresh my memory. Do we have like a set of plans that we can structure into the system for the next training?
I don't believe we have your plans yet, do we, Kayla? Strategic plan and such?
I did send our strategic plan
Oh, hang on a second. Let me see.
a little bit ago.
It's in there.
Okay.
It's loaded in there.
Okay.
Oh, okay.
Oh, it is. Okay.
Sorry about that. There it is right here. Yep. My apologies. Yep. So let's take a look at your plan at the operational plan report. Okay, so we are, yeah, okay, yeah. I think this is probably the part that we structured in there. Let's see if we got any activities. That doesn't look like it. Okay. Yeah, the next step might be, and this is probably be a good training session to set up, is actually going through and showing you what we've done so far, what the next steps are to get this plan completed in there, and then potentially talk about developing some activities to go with your objectives. Would that be good?
Yeah, that'd be
Okay.
great.
I'm going to send you some templates that we give to clients to practice, you know, kind of like a dry run of maybe thinking about some of the activities and thinking about maybe who you might be assigning them. And it's just kind of a reference for you to learn the nomenclature and the structure in the system. So I'll send that over to you as well. Kayla, did I send you the implementation guideline? Oh, yeah, I did.
Yes. Yeah, we did. That.
And I showed them where it is in the help screen too. This just by the
So
way.
what, you know,
Go ahead.
I was just going to tell them that, so we like to build on this. And so this first one was to be able to see where you contribute in this whole plan, what you guys all do and where your piece of the puzzle fits. And then what we do is we start breaking it down. And as you go along and you want to dig deeper into some of the other functionality of the system, we just keep, it's a building process. So know that it's very robust and there's all the training that you need. Okay, Fred, sorry to interrupt.
No, I was just going to show you, this is when you click documents here, it shows you all the documents that are attached, and your strategic plan is attached right to the group strategic plan in there. So just an example. But yeah, we'd love to go through and walk through what we've done in your strategic plan, what the next steps are for you guys, and let's talk about what kind of activities could we develop in here to extend the plan out to that operational level. So why don't you send Andrea some dates and times? Our schedule is fairly flexible, so send her some dates and times that work for you guys. And if we got to do multiple sessions, we're happy to do that as well.
Awesome. Will do. Thank you.
Okay. Any other questions before we sign off and let you guys get back to saving the world?
Okay.
Okay, everybody. Well, thank you so much for your time today.
Thank you so much.
Thank you.
I will post this
a great
recording
one.
for you, Kayla.
Okay, great.
Put it up on YouTube for you and send you the link.
Awesome. Thank you so much.